Good afternoon, everyone. My name is Donna Mimikos, and I'm a proud volunteer with AARP Michigan and a retired nurse with over 45 years' experience in healthcare. It's wonderful to be here with all of you. Thank you for joining us. Today, you are in the AARP Ask the Doc virtual series, a space where we dive into health topics that matter most as we age, guided by leading experts who are here to inform and empower us. Today marks the fourth event in a series of a five-part series. It's been an exciting journey so far. We've explored topics like weight loss options with Ozempic and intermittent fasting, and honest conversations about sex and aging, and discuss the emotional and physical demands of caretaking for a loved one. And we're not done yet. Mark your calendars for the next session, on May 29th, where we'll take a deeper look at positive approach to dementia care, a truly important topic that offers hope and practical strategy. You can register for that using the link in the chat and view previous events in the series as well. And yes, these events are completely free. Now, let's turn our attention to today's hot topic, cannabis and healthcare. There's a lot of buzz behind the headlines and hype that's the reality. Things like, can cannabis help us with joint pain, sleep issue, improving quality of life? What do we know about its risk, its legal status, and the science behind it? To set the stage, here are a few fascinating facts you might not know. Nearly 1 in 5 adults over age 50 have reported using cannabis, often to manage conditions like chronic pain, arthritis, anxiety, insomnia. Some studies suggest cannabis can help reduce dependence on opioids and other prescription medications. Cannabis, like CBD and THC, interact with receptors in our body's endocannabinoid system, a network that plays a key role in regulating pain, mood, sleep, and appetite. However, not all cannabis is created equal. Strains, dosages, delivery methods like edibles versus oils versus vaping can lead to different experiences and outcomes. Today, we'll get to the truth, so let's get started. To take us through this conversation, we have here with us today Amanda Holm, a senior project manager for Henry Ford Health's Tobacco Treatment Service. Amanda administers tobacco-related research, education, and treatment programs, and has expanded her expertise into topics related to cannabis and marijuana use due to the growing prevalence in Michigan and elsewhere. She has reviewed research related to cannabis and marijuana from the basis on what you should know about cannabis and healthcare related to the dangers of vaping and the impact of smoking marijuana on COPD. Amanda received her Master's of Public Health degree from the University of Michigan, Ann Arbor, and holds a national certificate in tobacco treatment practice. We'll ask her to kick off with her knowledge on the topic, but then we're going to turn things over to you, our audience. We've researched the majority of our time for your questions. If at any point you want to ask a question, just put it in the chat and we'll do our best to get everyone's attention. Please note that we have high volume attendance here and we may not get to all the questions, but we'll do our best to address a variety of topics on this. And now it's my privilege to turn things over to Amanda Holm. Amanda?
Thanks, Donna. As Donna mentioned, I'm Amanda Holm. I'm the Senior Project Manager in the Center for Health Promotion and Disease Prevention at Henry Ford Health. Today, I'll be speaking to you about the public health implications of cannabis use. This presentation was adapted from one developed by Dr. Elaine Seville, who is a preventive medicine resident from the University of Michigan, who completed a 3-month rotation with our department a couple of years ago. And first, so that we're all on the same page, I wanted to review some relevant definitions regarding cannabis. Some terms get confusing because they may be used interchangeably when they're really not. Cannabis is the Latin name for the genus of plants which make a thick substance full of more than 100 chemical compounds known as cannabinoids. Cannabidiol, or CBD, and tetrahydrocannabinol, or THC, are the most common ones found in cannabis products. THC is the primary psychoactive compound in the plant that produces the euphoria or high feeling. And then CBD is the active chemical in the plant that doesn't cause the high feeling, but that people perceive to be beneficial. If you've paid any attention to pop culture over the years, probably many of you have heard of several ways people use cannabis. It can be smoked as a joint, similar to a cigarette. Blunts are cigars or cigar wrappers with marijuana inside, or it can be used in a bong with or without a water pipe. Like tobacco, it can also be vaped, and it can be added to foods or drinks such as cookies, cakes, brownies, gummy candies, teas, colas, or alcohol. Edibles have been becoming more and more popular. Dabbing is where concentrated doses of marijuana extract are heated on hot surfaces until vaporized and then inhaled to give an immediate effect. And then topicals are made by heating concentrated marijuana and applying it topically, like on the skin. These products usually don't have high enough levels of THC to produce psychoactive effects. That's just specifically the topicals. There are a few prescription medications derived from marijuana. Epidiolex is the only FDA-approved plant-based marijuana product. It contains a purified form of CBD, and it is used to treat seizures associated with rare severe forms of epilepsy. The FDA has also approved 2 synthetic forms of cannabis called dronabinol and nabilone. These are used to treat nausea in cancer patients undergoing chemotherapy and to increase appetite in AIDS patients with wasting syndrome, which basically means severe weight loss. So you can see the approved, well-researched, evidence-based medical uses of cannabis or marijuana products are very limited. No other products containing cannabis have been FDA approved. Next, we have a few quick facts on marijuana use in the U.S. and in Michigan. I know we have a lot of folks from across the country, so we'll start with the national data here. According to data from the CDC, marijuana is the most commonly used federally illegal drug used in the U.S. In a recent Gallup poll, 15% of adults say that they smoke marijuana, with 47% having ever tried it. In 2021, we saw 12% of people age 50 and over reporting past year use, with 4% using it 4 times per week or more. In 2022, the rate of its use increased in every age group. And over time, there has been a 7-fold increase in use by people age 65 and older. Finally, 3 in 10 people report symptoms indicating cannabis use disorder, which we will discuss more later. Here in Michigan, 1 in 9 residents used cannabis within the past month, which is a 75% increase in that rate since 2010. Our rates are higher than other Midwest states for prevalence of marijuana use. We haven't seen increased rates of cannabis use disorder since legalization, which is good. However, almost all of the recent increases in our use rates occurred following the legalization of medical cannabis in 2008. As of December 2024, we're seeing that about 79,000 Michiganders have a patient or caregiver medical cannabis certification, down from 300,000 in 2018, probably because recreational use has been legalized. And almost all people obtain their prescription for this for severe and chronic pain. And here's the list of qualifying medical conditions for which you can get a script for medical marijuana in Michigan if you're an adult. To be clear, there is not strong medical evidence in all of these cases that marijuana is beneficial, but that's the list of conditions that is sort of official for the state of Michigan. Some of the potential benefits of marijuana use that have been scientifically studied are related to treating cancer patients' nausea associated with chemotherapy, pain relief, particularly for neuropathy and possibly migraine headaches, and increasing appetite in AIDS patients. However, a 2022 review of the evidence suggested much of the pain relief effects of cannabis may be due to the placebo effect or positive expectations for the ability of cannabis to relieve pain. Then again, a Canadian clinical practice guideline from 2023 supports the use of cannabis-based medicines to help patients with chronic pain reduce their opioid use. So there are some conflicting results in this area. Some studies have also shown benefits in treatment for glaucoma, Parkinson's disease, multiple sclerosis, anxiety, or depression, but the literature is mixed about these, meaning some studies also show the opposite or no effect. So let's take a look at some of the potential drawbacks and risks around marijuana use. First of all, to kind of frame this, the health effects that a person might experience may depend on how much they use, how often they use it, whether it's combined with other substances like alcohol, tobacco, or other drugs, the method by which they use it, whether the person has a prior history of substance use, their DNA or genetic background, and their gender. Incidentally, one perception that may be out there is that CBD enhances or improves the effects of THC, but new research where the two together were ingested in an edible suggests CBD combined with THC increases its bad effects, including anxiety and other unpleasant sensations. One of the most concerning health impacts is that of addiction or development of cannabis use disorder. This is when someone continues to use marijuana despite disruptions in their health and relationships. Among users, about 10% have a likelihood of becoming addicted. And a key characteristic of cannabis use disorder is needing to use a larger amount or more concentrated products over time to get the same high. That is, developing a tolerance for cannabis, which also increases the risk of physical health effects. Finally, risk for developing a use disorder is higher if you started at a younger age or if you use more frequently. People with chronic pain who may be self-medicating with cannabis are at greater risk of cannabis use disorder also. And here's a listing of the standard criteria for having cannabis use disorder. I'm not going to read through them all, but the essence is that cannabis use becomes a psychological disorder when it interferes with health and function, and the person is unable to stop even when there are negative consequences. Withdrawal from cannabis symptoms are listed here. Withdrawal is generally not as severe as from other drugs, but it does cause physical and psychological symptoms. These can vary from person to person and range from mild to severe. And of course, the longer the person uses, the more likely they will be to develop withdrawal when they stop. Marijuana does also cause other adverse effects in multiple systems of the body, including the brain. Short term, it causes immediate effects on thinking, attention, memory, coordination, movement, and time perception. It can have long-term or even permanent effects, particularly in children and adolescents, because it can impact their brain development and lead to school difficulties. One analysis showed a possible association with testicular cancer, and there have been associations with head and neck cancer as well. But really, most of the known health effects are on the lungs and cardiovascular system, particularly from smoking marijuana, because its smoke contains similar carcinogens and toxins to those found in tobacco. Studies have shown that it harms lung function, causing scarring and damage to small blood vessels in the lungs, increasing the risk for bronchitis, cough, and mucus production. People who smoke marijuana are also likelier to have asthma, with increased risk for those who use it 20 to 30 days per month. It's associated with an 80% greater risk of hospitalization and 27% increased risk of ICU admission after COVID infection. It's especially risky in combination with tobacco, with those who use both having a 12 times greater likelihood to develop emphysema compared with non-smokers. The good news, though, is that symptoms can improve when marijuana smokers quit. We also see increased risks of stroke, heart disease, heart failure, heart attack, and other vascular diseases. In particular, people who smoke cannabis daily have about a 34% higher risk of coronary artery disease. There may be special concerns for patients who are undergoing planned surgical procedures. Besides potentially dangerous drug interactions with things like warfarin, which is a blood thinner, and anti-epileptic medication, Patients who use it may have worse pain and nausea after surgery and require more opioid medications to manage discomfort, despite the perception that cannabis relieves pain. Marijuana may also interact with medications to treat insomnia, depression, and anxiety. People with cannabis use disorder may be at greater risk for blood clots, stroke, breathing problems, kidney issues, and even death. And the American Society of Regional Anesthesia and Pain Medicine released a guideline in 2022 about how doctors should assist patients who use cannabis. So they recommend asking patients about their cannabis use prior to procedures, postponing elective procedures for those who are seen to be under the influence at the time of the surgery, advising heavy users that cannabis may make postoperative pain harder to control, and counseling pregnant patients that cannabis use poses risks to the fetus and newborn. Contrary to popular perception, marijuana can contribute to mental health issues. Hundreds of studies link THC to the onset or worsening of psychiatric disorders. Frequent use or high potency use can cause disorientation, unpleasant thoughts, anxiety, or paranoia. Temporary psychosis and hallucinations can occur, and there is an association with schizophrenia in people who start using at earlier ages and who use more frequently. There's also a link to depression, social anxiety, suicidality, suicide attempts, and completed suicide. This is particularly concerning when you consider that depression is the third most common reason that people seek a medical marijuana card. And in Michigan, with recreational use, people don't need one anyway before they try to self-medicate with these things. Marijuana use definitely impairs people's ability to drive safely due to slowed reaction time and judgment, impairment of coordination, and distorted perceptions. Here in Michigan, we're seeing lower rates of fatal motor vehicle accidents in recent years, but a greater proportion of these have involved cannabis over time. It's more than tripled between 2004 and 2017. Finally, though marijuana has the reputation of easing nausea, one troubling effect of cannabis use is cannabinoid hyperemesis syndrome. Emesis means vomiting, so this syndrome also comes with intense stomach pain and chronic throwing up. This can be a life-threatening condition due to dehydration, electrolyte imbalances, and weight loss. However, symptoms usually resolve when the person abstains from cannabis use for at least 6 months. And part of the reason we health experts get so concerned is that the potency of cannabis is so much greater than it used to be. Instead of 2 to 4% THC, products are commonly 15 to 24% or even higher. So this means 80 to 90% of products are now considered high potency. This intensifies all the risks we've been talking about here, especially for young people, but not exclusively for young people. So my take-home messages, and I probably should have said at the outset, many of these are sort of my opinions about things. Like when I respond to your questions, it doesn't necessarily represent the policy of the entirety of Henry Ford Health or of every provider within Henry Ford Health System. But this is the conclusions that I have reached based on what I've researched. So the essence is there's no documented safe amount of marijuana to consume from person to person. There's a need to increase public awareness of all the effects of marijuana, and if my presentation sounds like very much of a downer or something like that, it's because I'm trying to balance the very positive perception of marijuana that's kind of out in pop culture, the general understanding of it, with the risks that I don't feel like are very well publicized. The scientific evidence for the benefits is pretty limited. The evidence for some of the harms that I've talked about is much more extensive. However, a lot of healthcare providers don't receive training about this in medical school or thereafter. It's definitely a good idea to ask your doctor whether any medications you're taking might interact with cannabis, including anything you take for insomnia, depression and anxiety, opioid-containing pain medications, seizure medications, and blood thinners. Smoking cannabis is particularly risky, and so if people are going to use cannabis, some experts would recommend opting for products that are not inhaled, like edibles. However, with edibles, people have to be extremely mindful of what dose they may be taking. These products can be very concentrated, and what seems like a single serving of a food item, like a cookie or a brownie, might really be multiple doses of THC. So moderation is key. Safety should be prioritized through personal responsibility and knowledge, and just understanding as best you can what you're getting into with using a particular product. I would also just make the note that overall, non-use of cannabis is the norm among all age groups. And certainly, in my opinion, it's probably the healthiest choice overall. Older people who are already at greater risk of developing health conditions and chronic diseases should be especially conscious of the potential risks and review them with their doctors. And so that's what I have for you at the moment. Thanks for listening, and I'm looking forward to the questions and comments.
Thank you so much, Amanda. Very interesting. Now it's time for questions. I want to remind everyone, if you want to ask a question, just put it in the chat and we'll do our best to get to everyone's questions. So, let me see. One of the questions we have here, Amanda, are how do you find a high quality topical CBD product for my osteoporosis needs, and how much and how often to apply?
Well, that's something that I haven't seen a great deal of scientific literature on. When I recommend anything, I would try to base it on, what the science says. And so, honestly, I would consult with your physician, your healthcare provider, and let that person know what you're feeling with your knees, and explore different options. Ask them how CBD might be effective. And honestly, it's something I don't have a lot of detailed expertise about, specific preparations and that kind of thing.
I see. Another question we have from Sheldon is, what about using it to help fall asleep?
Sure. So I will put a link in the chat from the Sleep Foundation, which discusses cannabis for sleep in detail. The key messages are essentially that kind of in the short term, it seems like cannabis can help insomnia. Using it long term or every single day puts you at risk of some negative health effects, and may actually have an effect that impacts your sleep badly. That, in other words, it might negatively influence your sleep after use for a chronic period of time. So I'll put that link in that. I find that contains some good details. The Sleep Foundation is, I think, pretty reputable. And so it explains how that works and how it might assist in certain conditions. Chronic pain is one of them. PTSD, multiple sclerosis. It may assist people in getting to sleep, but using it on a frequent long-term basis, kind of like with any sleep preparations, might have a counteractive effect in the long run.
In addition to the sleep aid, part two of that question is there a risk of balance problems if you get up in the middle of the night?
That's a good question. I don't know if there's been research specifically on that. It's certainly the case that cannabis generally can have impacts on balance and movement, can cause dizziness and that kind of thing. So if that's something that you're at all prone to, I would perhaps advise avoiding that. If you're going to try a product, maybe try it out at some other time of day so that you know about its effects on you over the course of several hours, and see if that's going to be an issue for you.
I see. We have another question on the use of cannabis for glaucoma. Is there any value in that?
Possibly so. I don't think there are any FDA medications that have made use of that. As far as having it prescribed, I don't know that you can have someone do that, because doctors are required to prescribe FDA-approved medications. So if it were me, I would be talking to my doctor about all of the different other glaucoma medication options, and asking if using that could be beneficial in addition to those, or what have you.
How about the use with blood thinners, if you're on blood thinners?
That's one that I would definitely avoid. That was a consistent concern that I've read about, that it can interact with blood thinners very much. And so I would not consider using those two together, certainly without consulting your physician. And I would just add, generally, do talk to your physician about any of these things, just because, at least in Michigan, where we have, recreational marijuana is legalized, I don't think any doctor would have any issue about hearing that kind of question from a patient. I'm sure they've heard it. I'm sure they would be interested to help you make a safe choice.
Interesting. Another question we have here is, RSO cannabis more dangerous?
I'm not sure what that refers to. I have not heard of RSO, so let me take a look and see if I can look something up about it. But it looks like it's an oil type of thing. It looks like an extract that is an oil-based type of product. I'm seeing, just again on a quick Google search is all I'm doing here. It sounds like it has a very high THC content, so I would be a little concerned about dosing with that kind of thing. Because there isn't a whole regulatory framework where the FDA has approved these things, that they're standardized. It's one of those things where you're kind of experimenting on yourself a little bit. And so if it were me, I would start with, the lowest possible doses, to obtain what effect you're going for. That's really true of lots of medications, is that you don't want to use more than you actually need to obtain the effect or the treatment that you're looking for.
Thank you. What are the risks taking cannabis in psychotic meds?
I would worry that the cannabis would counteract some of those, or interact with them as well. Just because psychiatric conditions definitely can be impacted by cannabis, particularly by frequent or ongoing use of it. And so that's something I definitely would talk to your physician, psychiatrist about, so that you're not working against the medications that are trying to help you manage your behavioral health condition.
Yeah, thank you. Can long-term use cause dementia or enhance the possibility?
That's one I haven't seen evidence around. I would certainly be concerned about smoking it in particular, just because the smoke itself is harmful regardless of the THC or other psychoactive components of it. So that's one where those toxins go all throughout your body, since they're going in through the lungs. And so that's not one that I've specifically seen research on, but honestly, it wouldn't surprise me. So,
yeah, well,
but I just don't know for real.
In any of the formats, not just the smoke, like the gummies or the vaping or the smoking, in all forms, I assume you're talking about.
Well, it's just hard to know. One of the big messages here is we don't have as much research evidence as we need to make some of these decisions yet. Because of it being illegal for so long, because you can't really get federal research dollars to research it, which is what it takes to do large enough studies to give us good evidence, then we kind of just often don't have answers to a lot of these very specific questions that are very relevant to people who might be considering it, using it for quality of life types of issues.
I see. Does it reduce CBD, reduce inflammation?
I I have not seen research to that effect. It's one of those things where people perceive it to, improve their quality of life, and it sort of hasn't been quantified, I would say.
I see. Okay. Let's see. I think there's other questions here, which I'm trying to look at. How does it, just let me go through this. Is there a way to slide down the chat so I could see the rest of the questions, please?
If you look at our presenter chat, there should be a scroll bar on the right there that you can scroll up and down.
I got it. I have it. Okay.
Great.
Okay. What are the possible side effects of a topical use of cannabis?
That might really depend on the preparation and the ingredients of it. Besides the CBD itself, that's usually like a topical. What topicals have in them is usually CBD, not so much THC. And someone's asking, does it have the same bad medical effects stated about THC? We kind of don't know. It certainly doesn't have some of the psychoactive effects, like the high feeling, the emotional effects, the anxiety and that kind of thing. But it's not very well. It's even less well researched because it's so relatively new on the scene.
Okay. What is the best method for anxiety and heart disease?
Certainly, I would, like I said, avoid smoking altogether of any kind, really, for heart disease. I come to this from a long background in tobacco use, and I just know that that's how smoking something works. It just puts a lot of carcinogens and toxins right into your lungs that go right into your bloodstream. So I would always counsel avoiding smoking the product to the extent possible. Beyond that, I would just be real careful about, frequency of use. All of the data suggests the more and the more often that you use, and the potency of what you use, the more likely you are to have effects of anxiety and, depression, other emotional types of things. It's not totally clear to me whether using cannabis in a non-smoked form is going to lead to all of the same heart disease and vascular effects. That's something that, again, needs more research.
Okay. What is the best form? I think we answered this question. What is the best form of cannabis and stress and anxiety? I don't know if you have anything else you want to add to that.
That's the thing that I would caution, is that it can have the opposite effect. For some people, it will relieve stress and anxiety. For other people, it will enhance it. And so it's basically an individualized enough thing that it's hard to recommend one specific thing that is best for everyone to try or to use. My main recommendation is proceed with caution if you decide to try it, and talk to your physician about whether that's a good idea for you with your personal health.
I see. How about helping with headaches?
There's some evidence around that. I know there are also, in the case of migraine headaches, there are also other, FDA approved medications that perhaps a healthcare provider would want you to try first, just because they are regulated, standardized, proven to be safe and effective. And we can't necessarily say that about all of the hundreds and thousands of preparations of marijuana and cannabis that are out there.
Another question is, can cannabis affect your gums?
I have not seen any research to that effect. Generally, smoking any type of plant material, including cannabis or tobacco, is bad for your oral health. It causes gum disease. Or rather, smoking tobacco has been pretty well demonstrated to cause gum disease. And because it's the same kind of burning a plant leaf process that's happening there, that it's likely to be a risk for that, for gum disease, periodontitis, cavities, oral cancer, all sorts of things.
I see. Another question we have here is, which type of cannabis is most effective for our arthritis pain relief?
It's a really good question. But again, I feel like I'm very much hitting the same notes here, which is that there has not been enough evidence yet, through doing the science around all these things. And it's such a catch-22 because of the whole, the federally illegal part of it means it's very hard to get funding to study this kind of thing. So, I certainly would advise against smoking cannabis for pain relief. And so, consult with your physician and start low and slow if you're going to do anything like that, because what you don't want is to overwhelm yourself with side effects or other symptoms as you're figuring out what might work for you.
Thank you. A question from Barbara. Which would be better for long-term overall help to get a good night's sleep? 25 milligrams of trazodone or a CBD/THC product meant for sleep?
I definitely am not a physician, so I'm not going to speak to comparisons between cannabis and medications in that sense. Like, I don't know dosing. That would be a question for someone's physician. And what I would say, I have done some health education presentations on getting better sleep. A lot of it is, there are a lot of different behaviors and things, and maybe the ARP would like to do a follow-up presentation that's more focused on how to get better sleep, because I think that's a big issue with a lot of people. But those specific recommendations, it may come down to a lot of different things in your environment when you're sleeping, in dealing with chronic health conditions or pain that's preventing you from sleeping. Like, there's all sorts of things that could be different ways to modify your environment, your habits, your medical care, to improve sleep, that would not have to involve making use of a product that isn't regulated and necessarily proven to work for the issue.
Question from Bonnie is, should it be considered for regional pain syndrome as a result of a stroke?
That's a tough question, and I would say, in my opinion, it would be concerning, particularly if it was in smoked form, because that's going to affect the cardiovascular system, which is, when you've had a stroke, you definitely don't want to add any more risk factors in that regard. But in terms of it being for pain relief, I mean, I know pain is a very tough and complex question to address for a lot of people. So I would say definitely avoid the smoked types of products and maybe talk to your healthcare provider. I'm a broken record at this point, I know.
Yeah. Well, here's an interesting question from Karen. How are the issues going on within the federal government and the Department of Health and Human Services going to affect the availability and use of medical cannabis?
That is a fascinating question. And I think it's difficult to predict what might come with the changes we're seeing in the federal government with this new administration. I haven't seen anything suggesting that it would impact the status of Michigan's laws, for example, around its use and availability. And so I don't have any foreknowledge about that. It might be a little hard to predict.
Yes. Another question for Michael is, I have a frozen shoulder, 60 days of therapy did not help, not interested in surgery, periodic pain in the shoulder. Can a cannabis rub alleviate pain? If so, what kind?
Yeah, you can tell that coming from the healthcare side of things, you know, because everything is so new, it's hard for me to recommend evidence-based treatments that are based around cannabis. You know, that's a tough question.
Yeah.
I don't even know what to recommend since it's not my area of expertise with that specific condition. You know, I'm wondering if massage or something like that would be something to look to as an option, but I don't know if that's a very satisfactory answer.
Okay, thank you. Is there a difference related to gender in cannabis use?
In general, there are differences that when it comes to different kinds of medications, you know, people of different genders have different metabolisms and different levels of various hormones that may impact their metabolism of THC. There's the fact that men and women store fat in their bodies differently, and THC is a fat soluble chemical. So, you know, if you have more fat that's stored in your body, then you may have more of a buildup of THC that can affect you over the longer term a little bit more. Certainly there are differences related to the average size of each person and what dose, you know, kind of works for them or affects them, you know, more strongly than they might prefer. So that's a couple of possibilities around gender differences there.
Another question from Jay is the physical health effects on the cardiovascular disease. He's addressing, are these issues only if smoked, or are there other causes, including ingestion and topical? I think the question relates to, is it least harmful topical application or ingestion of it?
I think that is an important question. And I think that the research so far has largely been conducted with people who smoke marijuana because that has long been the most prevalent way to make use of it. So I would suspect that at least part of those effects, if not much of those effects, are related to the smoking aspect of it. And so, you know, I certainly would discourage using it in that method. It's hard to speak to the long-term safety of these other preparations because the research just isn't there yet.
Yeah, this may be the case in this question as well. Specific types used for ADHD, OCD, PTSD, migraines, chronic muscle inflammation, and related pain.
Again, there are so many products out there and they have not gone through the scientific research process to know whether they actually have, you know, the effects that people might be looking for in those senses. So if people are making use of them hoping to treat those things, it's going to be a very individual basis. There isn't a guideline or recommendation that kind of clarifies that.
Question from Lori is, I have kidney issues, so can't use non-steroidal anti-inflammatories. Mm-hmm. Will that be true of cannabis?
That is a good question. It is one of those areas where I haven't seen a lot of research around the effects on kidney function. You know, that's still kind of a question mark. I would proceed with caution. If you have organ systems that are kind of compromised in different ways, I certainly would be surprised if the smoking version was harmful to that, because again, smoke is one of the big issues, even more in as much or more perhaps as the THC or CBD itself, but the components of the smoke. So that's another one to, talk to your doctor. With chronic conditions, I would hesitate to mess around with anything that is hard to know what you're getting.
True. Annette would like for you to tell her about THCA.
I am not familiar with THCA. I'll take a quick look here and see if I can find what that is. It looks like it's a precursor to THC. And so it apparently itself is non-psychoactive, so I'm not sure it would have the effects in the same way as, the usual THC would. Apparently it converts to THC when heated. So, that's something I have a ton of information on. So I see in the chat we're supposed to wrap up, aren't we?
Thank you, Amanda. It looks like we're out of time. We had so many questions here. Please join me in thanking Amanda Holm for joining us today. And as mentioned earlier, Ask the Doc event is on May 29th, where we'll discuss dementia care. The link to register is in the chat. Thank you all for coming and have a wonderful day.